patient today, her name is Irma White. She is a 65-year-old female who was admitted into the hospital with an exacerbation of COPD. Her past medical history includes seasonal allergies, asthma, anxiety, and pneumonia. I discharged her from the hospital with oxygen, 3 liters, but she was very non-compliant with it and stated that it limits her, so I would check on that in the home and see if she's using her oxygen appropriately. Her only visitor in the hospital was her 21-year-old granddaughter, Sarah, who takes care of her at home. She is a widow, has 3 children who are not from the area. She states that she loves her 4-year-old German Shepherd, and she has had Shepherds throughout her life and her entire childhood, so if you're allergic to dogs, I would be careful. She had trouble sleeping in the hospital because of her anxiety. She states that she was feeling very anxious in the hospital. Her medications include Symbicort, 2 puffs twice a day, albuterol, 2 puffs as needed, Spiriva, an 18 microgram treatment daily, once in the morning. She takes oxycodone for pain. She has 2 5-milligram pills twice a day, and 2 5-milligram pills as needed for breakthrough pain. I still have her on the 3 liters of oxygen at home. I have her on a folic acid pill once in the morning. And she's on Flonase for her seasonal allergies twice in the morning. 2 puffs in the morning. Okay.
Yeah, sure. Hi.
Hi, I'm Stephanie from the Visiting Nursing Association.
Oh, okay.
I'm here to see our lovely Irma here.
Hello.
Hi, how are you?
I'm good. How are you?
I'm Stephanie. I believe that you're supposed to have this on.
Oh, I don't like to wear that.
You don't? Can you just put it on for me right
Oh.
now?
Oh. Makes
That's
me
all
feel
right,
like I have
Graham.
to sneeze.
It's probably this. You're spraying, cutting your breath off.
Well, it smells like wet dog in here.
Is this what you're eating?
Yeah, that's my snack.
What's that?
Just some Mike's Hard.
Can you take this for me?
Sure. And should she not have that either?
No alcohol
No.
with the medication.
Sorry,
I would not
Graham.
recommend it.
Sorry, Graham.
All right.
I'm gonna listen to your lungs real quick, okay?
Okay.
Take a deep breath for me. Okay.
You okay, Graham?
It just gets harder and harder to breathe.
Okay, I just wanted to go through all of your medications and your discharge orders from when you guys left the hospital, okay? And I'm sorry, I didn't get your name earlier.
Sarah.
Sarah? Sarah, how are you related to Irma?
She's my grandma.
Okay, do you do all of your care or her care with together?
I try to help.
Okay.
Isn't she so precious?
So, Irma, you were just discharged and the doctor sent you home with 3 liters. I heard you don't like wearing the oxygen.
No, I don't really like wearing it. I feel like it restricts me from my daily activities.
Well, do you get dizzy at all?
I'm tough. I can deal with
You're
it.
tough. Well, if you don't wear the oxygen, then your oxygen saturation drops down real low. That's why the doctor said that you have to wear it on 3 liters continuously, okay? You're putting yourself at risk to fall if you get up and walk around, all right, without the oxygen on.
You sound like my granddaughter.
Remember when you stood up the other day and you got really dizzy?
I wanted to go over your medications with you. That was part of, the doctor had asked me to make sure that you know what the medications are for and make sure that you're taking them correctly, okay? So I see that they're up there. Is that where your medicine stays?
Yeah, I don't really know what all those pills are. I just take them every day.
Okay. Well, you have, the doctor told me that she decided, to send you home with Symbicort, which is an inhaler.
That sounds familiar.
Okay, albuterol, which is an inhaler as well too.
Oh, is that the red one?
No, that is Symbicort, the red one. The blue one is albuterol.
I
And then
take those about 8 times a day.
8 times a day. Ooh, okay, so let's go through every med together then. And let me make sure none of them are expired and you have the right prescriptions, and then we can, go through each one and you know what they are, and then you also know what you're using them for and how often to use them. Do you have discharge papers at all?
We had them, but I'm not sure where they went.
I have all the medications listed here, and we can go through them. So is the pink pill bottle hers?
Yes, that's
Okay,
hers.
do you go through every day? How do you normally dispense the medications to her?
We usually put them in every day, and then I'm not here with her every day, but
Okay.
I
Is
hope
she
that
able to
takes
take her
them.
medications on her own?
She is.
Okay.
Down the hatch, I just take them all at once.
Can you just hand me the meds and then we can go through them together?
Yeah, do you want all of them?
Yes, please.
Got a lot of pills there.
You do, but they're all necessary for when you have COPD. All right, so as we talked before, this is your albuterol, okay? The doctor prescribed it so that you can take 2 puffs, and it's when you're short of breath and you feel like that anxious feeling and you feel like you cannot catch it. This is called a rescue inhaler. It'll help you, all right, in that time of need. And you only take 2 puffs at a time, okay? No more than that. And then you have to wait a few hours until you could take it again. I think the doctor prescribed it for every 4 or as needed. But if you're using it multiple times back to back, you said 8 times in one.
Yeah, sometimes I use it up to 8 times because I really can't breathe.
You can't breathe. Okay. If anything like that happens, you might need to call the doctor, okay? Because that's too much. You're over medicating yourself and you don't want to do that, okay? This red one it's called a corticosteroid. It's your Symbicort, okay? So what it does is it helps you reduce the inflammation in your lungs, all right? And the doctor prescribed this 2 puffs twice a day, okay?
Thank you.
This is your Spiriva. Do you have the inhaler for it? Do you guys know where it is? This is a pill inside of here. It's a capsule. So what you do is you put it inside of, it's a little oval shaped inhaler, and you squeeze it kind of and you inhale the medication.
I didn't know you had a third inhaler.
Okay.
I haven't been taking those.
Okay. Well, I will look into seeing if we can actually get you another dispense inhaler, but this is a medication that you're supposed to be taking, okay? It's Spiriva, and it's a bronchodilator, so what it helps is it opens your airway as well, too. And,
So
and
it
it's
would help me breathe.
Yes, and it's once a day, okay? In the morning, you're supposed to take it. All
And
right?
I can't eat it?
No eating it,
Oh.
just inhaling it inside of an inhaler, but you're missing that piece, so we can look into getting you that, okay?
Graham, you've never swallowed this, have you?
I don't know. It looks really familiar. I might have swallowed one.
Okay, well,
I can't remember
don't
these
do
days.
that anymore, okay?
2 bottles are your oxycodone, okay? It's a pain pill.
This stupid thing never works.
Okay, can you, one moment, I'll teach you how to use it, all right?
Okay, Graham.
I just want to go through the medication right
This
now.
is very important. Let's listen to what she has to say, okay?
All right.
Okay, so these are very serious, okay? These are her oxycodone, they're your pain. Do you have any tightness in your chest or pain when you're breathing?
Yeah.
She
Yeah.
complains about it all the time.
Okay, well, one is prescribed for twice a day, so it's 5 milligrams twice a day, okay?
Okay.
Every
What does
12
that pill look like?
every
Is that a
12
blue
hours.
pill? Oh, it's the blue pill.
All right, and then it's prescribed again for PRN in case you're having increased pain. All right, but you want to make sure also that you're letting your granddaughter know, and then you're letting us know when we come back and visit you that you're having an increase and you're using your PRN one, which is as needed, okay?
Okay.
All right, don't take more than what's prescribed, all right, because it can cause you confusion.
Okay.
All right? And
Are
then
you
you'll be
writing this down?
Do you want me to?
Yeah, because it's going to be hard for me to remember all these meds.
Okay. All right.
Folic acid, it's a vitamin, okay?
That
So-
one I remember.
You do. Your blood work came back and showed that you're anemic. So this will help with that, all right? And then also, you just need to make sure that you take it once a day, okay? So that's how the doctor prescribed it. All right? It also, if you have any nausea or upset stomach or any bad taste in your mouth, that is a side effect. So you just want to make sure that you let us know, all right, so that we can let the doctor know.
Okay.
You're welcome. And you have right here Flonase. All right. This, you do 2 puffs up each nostril.
It leaves a weird taste in my mouth.
It does. You're spraying it too much?
I don't know. I can feel it running down the back of my throat.
No good. Okay. Well, this is an anti-inflammatory. It helps with, your congestion and opens you up a little bit, helps you be able to breathe a little bit more, right? But if you take this more than what you're supposed to, it can cause rebound congestion and make the situation actually worse than what it already is. So it's to help you, but you don't want to take too much of it, okay?
Did you say 1 squirt?
I said 2 up each nostril. It's for your allergies.
Okay.
I have
Okay.
it written down. Don't worry.
Alrighty. Let me just make sure. And your oxygen is supposed to be at how many liters?
3.
Okay. Okay, can you repeat the medications back to me now?
This is my vitamin. This is my folic acid, and I take this once a day, right?
Yes.
Okay. This is the stuff that I squirt up my nose for my allergies, and I do 2 puffs each nostril.
Yep, when you're having allergies.
Only when I'm having them.
Yes.
Okay.
Okay, but you don't want to take this more than 3 to 5 days, right?
Yeah.
Okay.
This is my pain medicine, my oxycodone, right? Is that how you say it?
Oxycodone. Mm-hmm.
And I only take this as needed.
It's this one, yes, as needed, okay?
And this is the one I take every day.
Yep, and it's 5 milligrams, okay? So you take 5 milligrams twice a day, and then if you're having increased pain, here's another prescription. But you want to be careful with these. These are opioids, okay? So what they can do is they can cause you a lot of constipation, so you might need a stool softener, all right? So you might have problems going to the bathroom, or you might also have a headache, or you might be very, very sleepy if you over-medicate yourself, which can cause your respiratory to be depressed.
Well, I already have problems going to the bathroom. I don't eat a lot. I'm not hungry.
No?
Mm-mm.
Okay, we'll talk about that in a moment. Let's finish with the medications.
And then these are my 2 inhalers. This is my rescue inhaler.
Mm-hmm. And what is that called?
I can't pronounce the name. Albuterol.
Mhm.
And this is the inhaler that I take daily. I used to take 8, but you told me only to take 2 puffs.
I think this one you said you take 8 times, which is not good at all. But this is Symbicort, all right? And you take 2 puffs twice a day, all right? This is a steroid as well too, all right? So you have to be careful not to stop this abruptly because it can cause you some difficulties.
Okay.
All right? Alrighty. And there's one more pill up there.
Oh, this is the one that I've been eating.
Yeah, don't do that. Okay?
Spiriva.
I'm going to look into, I'll probably have to stop by tomorrow, but I'm going to look into getting you the actual inhaler, all right? So you're supposed to take one of these and take it out of here and put it inside of an inhaler. The inhaler punctures the capsule and you inhale the powder.
Are you sure they did send us home with that?
Did the dog eat it?
I don't
Lily!
think the dog ate it.
I don't know. That dog is crazy.
It's your dog.
Okay.
Will you tell me how to use this? Because every time I use it, nothing moves. See?
Okay. All right. How many times do you think you should use this? Did they tell you at the hospital?
I don't remember what they said.
You don't. Okay. So you should do this 10 times an hour. So in between commercials, if you're watching any TV, or just try to make sure you're doing it 10 times within that hour. But you put your lips to the end of this, all right? And you breathe in, and this little blue thing inside will raise all the way up. The higher you can get, the better, all right? It helps your lungs expand, decreases your risk for pneumonia, atelectasis. They talked to you about that in the hospital, I'm sure.
Yeah, they might have mentioned it.
Yeah, and it also breaks up also the secretions that you have. COPD, they have a lot of mucus inside of their chest. It makes it a little bit more difficult for them to breathe. So if you practice this, it'll help keep your lungs, elastic and moving.
So you're telling me that I'm just inhaling it?
Yep, you just take a deep breath in, okay? After you put your lips to that.
Okay.
So you want to make sure you're practicing this 10 times an hour.
Okay.
I wanted to discuss with you your nutrition. I saw when I came in you were eating pretzels. Those are kind of salty. Is
I
that what
love
you
salt.
snack on all the time?
In the morning I usually try to eat toast, but sometimes I don't get to it because I'm just not hungry at all.
Okay.
For dinner, I eat a lot of frozen food because my granddaughter's too lazy to cook for me.
Okay, so I also saw you had a Mike's Hard. Is that what you said?
Yeah, I'm old, but I'm not dead yet.
Okay, well you just got to be careful because with your medications, it's not, really good to mix alcohol with meds, okay?
It's only once a day.
It's only once a day, but you're already having a hard time breathing, and alcohol suppresses your lung capacity as well too, It'll hurt your breathing as well. Okay?
Okay.
And you're already tired? You said you're tired, right?
It helps me go to sleep.
It helps you go to sleep,
Yeah, I can't sleep at night.
but you're anxious.
Yeah,
So
it helps me
alcohol can
relax.
increase your anxiety as well too. So you want to make sure that you don't drink too much, okay? Try to limit that.
I gotta tell my granddaughter stop buying me it then.
Oh, okay. We'll have a talk about that later. Alrighty. Okay, so sometimes with COPD, you lose your energy quite quick because you're working so hard to breathe. So it's very hard. You get tired quite frequently. So you take a little bit of naps throughout the day. So if you get up and you want to make yourself breakfast, do you sit down and take a rest after that?
Yeah, I usually get really tired like halfway through breakfast and I have to lay down for a little.
Okay. Well, all of that too is going to hurt your nutrition. So you probably don't want to finish meals. You've lost a little bit of weight, I saw in your chart. So you want to be careful and make sure that you're eating the right foods. Snacking is not a bad thing, but we got to make sure that you're snacking on the right foods.
So pretzels aren't okay to eat?
Well, they're very salty and they're not something that is really recommended. I would prefer you snacked on maybe a hard-boiled egg for the protein. And hard-boiled egg is whole food, so it's a little bit more nutritious for you, okay?
What about peanut butter?
Peanut butter is a good thing, too.
Okay, because I don't really like hard-boiled eggs.
That's okay. That peanut butter is fine as well, too, but it might be a little bit hard for your tongue.
I think I can manage.
You can manage? All right, not a problem. Are you eating chicken? Chicken's a good source of lean meat and protein.
I eat a lot of pasta.
You eat a lot of
It's
pasta.
easier for me to eat.
Okay. Well, does your granddaughter cook anything for you?
Occasionally. Not all the time.
Well,
That's why I eat the microwave food a lot.
the microwave food sometimes has a lot of sodium in it, all right? So if maybe you guys can go to the grocery store, your granddaughter can go to the grocery store and just get you some lean meats, and we're worried about your protein, all right? Protein is very important for you, and also it's important, too, to keep your weight up.
Okay.
So that'll put, more nutritious things inside of you rather than you snacking and drinking alcohol, which is going to hurt your process here. So with the oxycodone, right, those are your pain pills, that can cause constipation, right? So we got to make sure also that you're taking a good fiber intake, all right? So you need a little bit more of your vegetables and everything to go into your diet. Are you eating any?
I don't eat a lot, but occasionally I'll have some veggies.
Okay. I'm going to talk to your granddaughter about your food. I just don't want you to have any BM issues and be constipated and backed up. And I also am concerned about your sleep and your weight loss. When you start to progress in COPD, you start to lose weight, and then your nutrition becomes a problem, and then you get really, really tired quickly, so you have to take frequent naps. And you said that you were anxious a little bit?
Yeah. When my chest gets tight, I get anxious.
Okay. Alrighty, well, I'm gonna talk to your doctor and your granddaughter, and we'll see what we can do next time I come to visit. I'm probably gonna stop by tomorrow because I have to finish correcting your medications.
Okay.
Okay? So I went through some of the foods that she's eating, and I'm just concerned because in her chart it said that she lost some weight. And with COPD, it's very important for them to maintain their weight when they get into the later stages, okay? So the foods that she should be eating are more, I'm worried about the protein. So she should be eating like chicken. She could have peanut butter. She said she likes peanut butter. I talked to her about eggs. She said she's not really a hard-boiled
she's
egg
not
person.
a fan of eggs.
Okay, well you could try. You know, maybe see if she'll eat it for you if you cook it different ways.
I like deviled eggs.
Okay, you could eat that.
All right, I'll try to make those for your Gran.
Veggies as well too has to be incorporated in her diet a little bit more.
Okay.
All right, and then it's okay if she has bread. She said she likes toast in the morning, but just make sure she eats. And sometimes large meals is too much of an effort. They get discouraged and overwhelmed. If you give her small, frequent meals and maybe meal prep them and put them in the fridge, that would be better.
How does that sound?
I'm tired.
Okay.
Alright.
One last thing though,
Almost
okay?
done.
If she loses too much weight, we there's protein shakes. Or I could talk to the doctor now about possible protein shakes, the chocolate, vanilla, or strawberry that she could drink,
I've
and
heard
it'll
of
help.
those.
Okay, they have a lot of vitamins and protein inside of it, and that'll help you. And it also has fiber too, which is what we talked about, your digestion. Okay? All right, I'll wrap my visit up. It was very nice meeting you, and I'll see you tomorrow, okay?
Okay.
Thank you.
I'll make
Not
sure
a
I'm here
problem.
tomorrow.
All right.